Today we'll talk about vitamin D, but prior to that, we'll describe in a few sentences what the word vitamin means. Well, vitamin is actually composed of two words. One is vita or vita, which is life in Latin, and the other word is amine, which is an amino acid. Towards the end of the 19th century, there was a thought that vitamins were actually amino acids, and it's a misnomer, but it stuck, and we still use the name vitamin. Actually, the first substance that we now know was a vitamin was vitamin C, the anti-scurvy vitamin, which was discovered by a very smart British Navy physician named Lind. It was in the 18th century, and he even ran a small clinical trial on 12 sailors. He gave them different foodstuffs, and the lucky two that received lime juice or lemon juice or orange juice did not or were cured of the scurvy. And this clinical trial, which was one of the first clinical trials in the modern era, marked our acquaintance with the first substance that we now call vitamin. So to vitamin D. Vitamin D, or by its other name, the sunshine vitamin, is actually not so much a vitamin but a hormone, because we can manufacture it, our skin can manufacture it after exposure to sun. But the quantities are relatively small, and the necessary exposure to the sun is quite substantial. So we know that we can manufacture it, but we pay a price of being exposed to the sun, and we know now that being exposed for a long time to the sun can lead to damage from wrinkled skin to more serious, more severe diseases, skin tumors, etc. So the recommendation now is to avoid excessive sun exposure. But our body can manufacture vitamin D. In this cartoon, we see a part of the complex movement of vitamin D in our bodies. As we see, it can be manufactured in the skin. It can also come from the diet. It goes to the liver. It undergoes a stage of, you can say, development there. It goes then to the kidney. And then from the kidney, the active metabolite of vitamin D is distributed to the whole body. And we see here that according to the scientist Holick, the preferred range of vitamin D levels is somewhere between 30 and 60 nanograms per ml. These are the units that some of the Kupot Cholim in Israel use. So the preferred range, according to this great scientist, is between 30 and 60. We should be careful because there is also a vitamin D intoxication, which is very rare, and you really need to take huge excessive amounts of vitamin D to reach intoxication. So this is a very good question. If we have a low normal vitamin D levels, or if our vitamin D levels are abnormally low, what should we do? Well, if it's abnormally low, that is below 20, the answer is very clear. You should go to your doctor, and most probably he will give you a prescription for vitamin D. The usual dose is somewhere between 1,000 units per day to 2,000 units per day. If your values are low normal, that is, they are low, but they are in the normal range, then it's a more difficult question. And in this case too, you should go to your dietitian or you should go to your GP and discuss the question with him. What you should not do, and we repeat that in all our talks, is that that these talks are intended to enrich and to give to broaden your horizon. It is not a recommendation to take vitamins or to take aspirin or to do anything based on the knowledge that you acquired from our talks or from reading, etc. Medical decisions should be reached after a thorough discussion between the patient and his health care giver, to use the American term. But please do not do it, do not try it at home, as they say.